Hello, everybody. I am Missy Berry, and I am the administrator here at Dedicated Home Health. And today I'm going to present your yearly mandatory in-service over unacceptable abbreviations. So let's hop right into it. So today we're talking about abbreviations that are okay to use and abbreviations that are not okay to use. We're really going to talk more about ones that are okay to use rather than unacceptable ones. So just keep that in mind when we're going through our list. These are acceptable abbreviations. So the policy and procedure that covers this is IM.1. So it's a pretty lengthy policy because it contains a large list of abbreviations that you may use in your documentation when you are charting about patients. And so I have attached that in the handout section on section 2 of your web module for this training. So make sure that you look at that. In fact, we're going to reference it mainly for this entire training. Like bullet 2 says, that abbreviation list is contained in that policy. And so those are acceptable abbreviations. Now, you need to understand those are the only abbreviations that you are allowed to use. If the abbreviation is not on that list, then you are not allowed to use it in any of your documentations, in your notes, in your plan of care, anything like that. If it is in Access and it is about our patients, you have to make sure that the abbreviations you are using are on that list that's on policy IM.1. So the way we check this and to make sure that you guys are following those rules, that's part of our chart audit process. Whenever we get that kicked off, you are going to start getting some things back saying, hey, don't use that abbreviation anymore, that kind of thing. That is something that surveyors do look at. We've had them mention that to us in the past. So just keep that in mind that if it's not on that list, then you're not allowed to use it. So you're going to reference that list, and I really want you to go over it. It's about 10 pages, but just scan down through that, especially my physical therapist, because you guys use a lot of abbreviations in your notes that aren't always common abbreviations, and rarely are surveyors therapists. So those therapists are going to clue in on that for you guys for your notes. So make sure therapists, especially that you are looking at that list. Nurses, you guys have to look at it as well. I want you to take note of a couple of ones that stuck out to me that I know I personally need to work on using. DC, normally we're just typing the letters D and C together. You have to put that slash in there. So discharge is D/C, not just the letters D and C. If you are going to use QD, BID, or TID for daily, twice a day, or 3 times a day, you've got to use the lowercase. I know a couple of my nurses use their caps lock to put their meds in. So just keep in mind that if you are using QD, BID, or TID, you have to use lowercase because that is how it's stated on our abbreviation list. Capital C, CC, is chief complaint, not milliliter. I know nurses sometimes do want to say like 5 cc's. That we do not have an abbreviation for that. So you have to use milliliters for that. It also does not stand for case conference. Centimeter is a lowercase c and a lowercase m. An uppercase c and an uppercase m is case manager. So remember that your uppercase and your lowercase do matter at times. PRN is capitalized and must always be followed by quantifier. So you can't just say, we're going to do this PRN. You have to say, we're going to do this PRN for what? This patient's going to take Norco 10/325 milligrams, 1 tablet by mouth every 6 hours, PRN for pain. You can't just ever type PRN. So if it's on a med list, especially on a med list because that's an incomplete order. So you have to put a quantifier. So you can't just say PRN on a med list, on a plan of care, or in your documentation, you have to put PRN for what. So make sure that you're using that quantifier. So now that you've completed this video, it was a short one, you are going to go look at that list of abbreviations. So make sure that you review that list. It's very important you look over that. And then the most important thing that you're going to do is you're going to do your sign-in sheet. So step 3 is to click on the link that takes you to the Google form that you fill out. That's your sign-in sheet for attending this in-service and getting credit. So make sure that you are clicking that link and doing that sign-in sheet. If you have any questions, feel free to come see me. Thank you.